afternoon, everyone. I need a better response. You're all full. Good afternoon. That's much better. Now, today, as Dr. Kelly has kindly introduced, I want to introduce to you our first speaker for this afternoon. And the topic is mastering the time capsule of diabetes. So our first speaker will be Dr. Andrew Muriithi. And a short bio is that Dr. Andrew Muriithi is a board-certified consultant anesthesiologist, and also he holds an MSc in aerospace medicine from King's College University. He additionally holds a diploma in aviation medicine from the Faculty of Occupational Medicine at the Royal College of Physicians of London. He heads the Department of Anesthesia at the National Spinal Injury Referral Hospital and is charged with the care of patients undergoing spine surgery and rehabilitation post-spinal injury. Doctors, where he transports critically ill patients across the world, and a designated aviation medical examiner with the Kenya Civil Aviation Authority. Isn't that an awesome profile? He has been involved in extensive training program mitigating the effects of COVID-19 across the airports, seaports, and border crossing in East Africa. He's passionate about human spaceflight and is keen on incorporating the potential benefits of the establishment of human space flight program across Africa. In addition, he's keen on looking at the safe and sustainable establishment of space report and supporting the development of occupational health standards and protocol, as well as astronaut selection criteria. So sit down, relax, and enjoy the flight.
So good afternoon, and thank you very much, Dr. for that very warm introduction. I will be straight to the point because we don't have too much time on this. So the nuggets for today are mastering the capsules of time and diabetes, and how human physiology is affected by time travel. So I will try and expound using several studies as well. So the objectives of my presentation today will be a brief introduction. We'll look at the cardiac rhythms and disruptions and discuss the physiology behind it, the overviews of circadian regulation on glucose metabolism, and eventually we will land on the impacts of circadian disruptions on glucose control. So statistics. About 8.4% of adults, as at 2017, the studies that I came across, are living with type 1 or type 2 diabetes. And these numbers are set to, skyrocket by 2045 to 693 million adults. Now, this high prevalence is attributed to multiple factors, key of which are the usual traditional, high physical inactivity, smoking, poor diet, but there's one that we may not think too much about, and that's circadian disruptions, and this is seen in our day-to-day lives. And from the meta-studies that I've come across, epidemiologically, 20% of individuals are involved in shift work of across different cadres, and this shift work has been noted to increase your risk of development of diabetes by between 10 to 40%. And among you, if you think about how many hours you sleep in a night and what your sleep hygiene looks like, 33% of those who slept less than 6 hours were also noted to have been at risk. So, circadian rhythms and their disruptions, why is it important? Our metabolic homeostasis is regulated by our circadian rhythm. And it's both exogenous and endogenous controls that are noted, with the endogenous rhythms associated with both behavioral and environmental factors. And the inputs for the environmental factors here are sunlight, which, back to our anatomy, hits the suprachiasmatic nucleus via the retinohypothalamic tracts, and this then further trigger both central control and peripheral control through various pathways, both neural, hormonal, as well as peripheral organs. So quick schematic from there. Let me see if I can get the pointer. Yep. So the sun, stimulates the suprachiasmatic nucleus, which then further goes on to stimulate the pineal body and other peripheral clocks that are seen in virtually all other organs of the body. from the adrenals, the liver, muscles, which control our day-to-day. On the far right corner here, you can see two aspects with the cosine waves for, oh, sorry, apologies. You can see that there's alignment and misalignment depending on how our exposure is. So when you're aligned, these cosine waves, we are able to see, that your metabolism is going to continue being as normal. If you're able to start working, your sleep-wake cycle is disrupted, and you're awake during your circadian night, you start to see certain misalignments across both not only your central clock, but also across the other metabolic organs as well. Now, and these are also controlled by other aspects, such as feeding and exercise, which all come together to bandy to have your control or circadian rhythm. So, furthermore, we have a look here at our modern alignment. Most of us are awake and work beyond our daylight hours. And so you also have artificial light. And this is our typical circadian day, where you have, and you're fully awake at this point in time. Your melatonin is suppressed. And when you go to sleep, there's darkness. You then have your usual melatonin spike, and you rest. Now, with misalignment with shift work, you will be asleep during the day. And in your circadian night, as you can see, you're also going to be eating at night, and you have some suppression of your melatonin, and this is where some of our problems start coming up. Fast forward into aviation and jet lag. We have a complete desynchrony. So you have on your you're fully awake on your circadian night, and because of the multiple changes in your time zones, you have not only your suppression of melatonin during the day, but also at night, there's a further suppression. You compare this to both shift work and your normal alignment. And these aspects have significant issues in terms of how it is that we control our metabolism on a day-to-day basis. The two aspects that we're going to discuss from meta-analysis, one will be an experimental study, and the other is going to be on just stats on how this is going to affect our metabolism. So, epidemiological studies noted that there's a 5% increase every 5 years for those who are having shift work. And this study was unfortunately conducted on nurses. So for those nurses in our room, please pay attention. You might be the ones who need to be change the rosters, or even the doctors here. So workers on a rotating shift had a higher chance of developing diabetes than those who had fixed night shifts. And this study was adjusted for age, BMI, glucose intake, and I forgot the last factor. But in essence, they adjusted for as many factors as they could. So if you're going to be doing shift work, you'd rather be on nights and nights fully, or days and days fully, because of the rapid dysregulation of your circadian rhythm. Now, once again, because you're also going to be eating at night, diabetics ingesting greater than 25% of their daily energy input after dinner time also are noted to have higher levels of HbA1c. So if you're diabetic on shift, eating at night, your sugar control is going to be 25% worse in general. Now, this was meta-analysis from epidemiological studies. I went further to look for studies that were, a first experimental study. In this study that I'm going to project here, we had a first experiment where your day was lengthened to 28 hours as opposed to your 24. So typically, and what they did then is that they gave a test meal as well to be able to see what the sugars are going to look like. So in A, you had your normal circadian day, 24 hours. They gave a test meal indicated in blue, and that was basically that, and we'll continue to elaborate on the same. In B, you had a lengthening of the day, and the test meal was given just before your circadian night began. And the results are going to be shown in both B and C. So on the B upper tract, here you have your glucose tolerance levels. And if you notice, in the blue, where you had the normal circadian rhythm, you had your postprandial glucose more or less come down just after your meal. So the meal is here, indicated in black on this graph. So for those who had a longer misaligned day on the first protocol of 28 hours, you can see your glucose tolerance was much worse, at least in comparison. As well, look at your postprandial insulin. For those in the misaligned cycle, you can see how much more elevated it is over a period of time, about 22% more than those who had a normal sleep-wake cycle. Again, in the rapid misalignment, for those say who are on shift work, you go on a shift tonight, no problem. Similar results were shown, as you can see on this, on part C, on the glucose spike, for those on the misaligned protocol. And as well, if you look at the postprandial glucose over time, so it does about a 22% increase in that. So those are the nuggets that I have for today. You take home. Value your sleep and sleep hygiene. If you're going to fly, know for sure. Also, one other fun fact, it would be do me an injustice as a space medicine practitioner if I didn't say this. For those of us who look at the space aspect, the International Space Station goes around the Earth every 90 minutes. So you have a 45-minute day and a 45-minute night. So it's very interesting when you study astronauts and how their sleep-wake cycles and glucose controls are with time. The period of adjustment becomes a lot harder, especially when you in the area of the International Space Station called the gondola, where we take all these fantastic pictures of Earth. But those are special populations where some of these things are studied. But because space tourism is becoming a thing, we're getting older populations of people who are able to afford, with multiple comorbids and cardiovascular conditions, who may be able to go to space. And as well, you'll start seeing some of these things. So with this little introduction, I would like to hand over to Dr. Gamal to continue the more practical aspects of our day-to-day.
Can I just go ahead? I'm good to go. Thank you. Thank you for the invitation, and I think mine is an easy task. I was asked to talk about practical tips. So I'm not going to look at very strong data, but I got to my slides. So I got to have a chance of looking at some few interesting things that I'll discuss with you. So what I'm going to look at is travel. How do you prepare for travel? I'll look at truck drivers. What should you advise them? What can they do? I'll look at traveling overseas, taking flights to different time zones. I'll also look at shift workers, how to help them manage their diabetes. So just practical tips. So mine is not too much data today in terms of research. Can I? Are my slides up? So also, interestingly enough, I'm going to bring up an aspect of storage of insulin, because you're all aware about the challenges we are getting with storage of insulin. How many of you think the insulin we have sometimes does not work in the market? Quite a number of you. So I'm going to show you why it doesn't work. And I've simulated a few temperature changes from where the insulin comes from. And that may be an interesting thing and may explain some of the problems we are having with insulin coming in with non-cold chain methods. So what I'm trying to do is just explain a few things about why insulin, although it can be stored for 25 days or 30 days at 25 degrees, when we just get our insulin from anywhere, we may actually have a challenge or a problem. And these are some of the things I'm going to try and simulate for you and show you. Another important factor that I want to mention as we start is our preparations for travel. How many of you ask your patients, come and talk to me before you travel? How many of you ask your patients? Yeah, he does that because he's in. How many of you ask your patients, come and see me before you travel? What do they need before they travel? You must have, yes, apart from changing, you must have a standard travel letter ready for you. Even if you're here to tell your secretary, listen, or whoever's there, can you issue a travel letter for person X? They are on the following. They'll need to carry their insulin. They'll need to carry their supplies. Do you have that? Do you all have that? In your clinics, the nurses? You should be able to do that because it can make a difference to somebody. Just imagine being stopped and asked, what are these medicines? Or just imagine going to a country and you've lost all your medicines. What will you have? It's a small summary you need to have. That's the first and most important starting point. Are we almost there, or should I just go ahead? Okay. The other important point is, should I carry my insulin always at 4 degrees whenever I'm traveling? Yes or no? Yes or no? Yes? Should I carry my insulin at 4 degrees when I'm traveling? Yes? Yes? How many? How many yeses? The guys at the back there, Nia Mujui. Yeses or no? So I should carry it at 4 degrees. Not really, by the way. Most insulins are stable up to 25 degrees for 30 days. Okay? For 30 days. So I want to keep it cool, yes. I can use a gel pack. I can use a wet cloth if I'm a truck driver. I will show you all those things. I can use different modes to cool my insulin, but I should not worry about traveling. And this is one of the challenges that you all face with your patient saying, I can't inject at lunchtime because I don't have a fridge. Do you hear that? So now you have an answer. If someone is using 10 units at lunchtime, they can keep a pen at work for 25 degrees for 1 month and it won't go bad. Okay? Rather than saying, I can't inject at lunchtime. Are you seeing that? Yeah? So, I'm going to show you how at different temperatures insulin gets degraded because it's important. All said and done, does it mean that since you've said insulin is stable for 1 month at 25 degrees, why are we fussing about where we get our insulin from or why we buy it? Why are we fussing? That's an important question and an important point. Because, number one, where this insulin came from, we don't know how long it was outside the fridge before shipping. Question? Okay. Have you seen how it's been shipped parallelly? How they ship insulin via normal cargo? Have you seen? It's in boxes. Okay? So, hypothetically, if I put my insulin in a normal carton box in India, in Turkey, or wherever, for 3-4 days before it's shipped, I've exposed it to a slightly higher temperature. Cargo holds, normal temperature 5 to 15 degrees. Right or wrong? Most cargo holds have temperature regulation. Dr. Bahendeka will tell us that long ago we were worried about insulin freezing in the cargo holds. It rarely happens because most of the aircrafts now have temperature control. But hypothetically, or our current guidelines tell us, do not put it in the cargo hold. So what is the reason? The reason is not so much the temperature regulation. The reason is you have to have medicine accessible on you. Number one. Number two, to avoid loss. Those are bigger reasons than the temperature in the cargo hold, because the temperature cargo hold is 5 to 15, which you can move the insulin in. So that's not a problem at all. Yeah? Should I continue? I'm trying to see what huh? Yeah, I can use, but no, I have my graphs there, so it's it's important. So what happens now when you have insulin coming in from outside the country? It's kept at the airport for some time, it's cleared, then it's taken to a pharmacy. And you know how insulin is sold in a non-cold chain fashion? Do you know how it's sold? Anyone? So I have a bag of insulin and I go from pharmacy A to B and I just sell. In the pharmacy, I don't know how long it will stay there. And then the patient has to use it. Now you have instructed your patient You can keep your pen for 1 month outside the fridge. But remember, when they have got it now, it's already outside the fridge for some time. So how much of the potency is remaining? And my estimates are, according to my projection, that if it stayed outside the country 7 to 10 days before coming in, it's about 78 to 80%.